The United Leukodystrophy Foundation presents Integrative Medicine, presented by Katherine McDonald.
Hi, everybody. Welcome. My name is Katie McDonald. I am a nurse practitioner at Children's Hospital of Philadelphia. I work in the Leukodystrophy clinic there, and I'm going to talk today a little bit about integrative health. I'm going to talk about a few specific topics, and I wanted to share this information with all of you guys because over the last year, I have done some education in an integrative health fellowship program through the University of Arizona and Dr. Andrew Weil. So I've learned a lot about different integrative health and different evidence-based practices that I thought would be helpful to share with you guys today. Give me 1 minute to see if I can switch my slides. Okay, perfect. So some of the topics I'm going to talk about today is just an overall general introduction into integrative health and wellness. I'm going to focus on a few specific modalities, including the autoimmune diet, mindfulness meditation, massage therapy, and aromatherapy. And of course, aromatherapy would have been much better if we were in person together, but it'll still be a lot of good information that hopefully you guys will benefit from. So one of the first things I wanted to talk about is why integrative health? Why was it something I was interested in learning about, and why something to kind of talk about and dive more deeper into? As I'm sure you guys know, being on the internet, you know, Facebook, all these places, a lot of people are talking about integrative medicine and different therapies and diet, mindfulness, massage, you know, essential oils are very popular these days. So I really wanted to dive in and understand deeper the evidence behind it. Do these things actually help? Is it just a placebo effect? And how these things could help our patients and families at CHOP. So I'm going to start out by talking a little bit about what is health. Here on the slide, you can see what the World Health definition is. It's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. You can see from this definition that it's really a shift from thinking of health as just the absence of disease to a broader concept and thinking about it as prevention and optimization of wellness, and really how healthy can we be wherever we are and making small changes to become healthier. So here, this is a very busy slide and there's a lot on here, but this kind of gives an overview of some of the tenets of integrative medicine. So the first is having that broad definition of health and really wanting to optimize health and wellness and not just prevent specific diseases or complications. It also includes a wide range of interventions, not just medications, not just surgery, but different types of options that may be considered, you know, non-traditional. Really focusing on coordination of care. And this is where, if you think about some of the other names that integrative medicine may have had as like complementary or alternative medicine, kind of all falls into the same bucket. But the idea behind integrative medicine and why it's a little different than those is that you really coordinate and bring these modalities and these treatment options into your medical team and with your medical providers to create a really comprehensive care plan for yourself, your child, or your loved one. It also is a patient-centered care practice, which, working at CHOP, that's our big focus. So that's not a huge difference, integrative medicine versus what we do every day. And then again, focusing on a variety of modalities, not just those traditional things, but thinking about yoga therapy, aromatherapy, diet, mindfulness, meditation, and how all those things play a role into our health. So one of the things I think is always important for us to do is how do we define health in our life? What we may think is important and what makes us healthy may be different than what somebody else thinks makes them healthy. And it may even be different than what your doctors think makes you healthy. So being able to define this for your own life is important when you work with providers and come up with a goal and a treatment plan. And then what does it mean to be healthy to you? So the first thing I'm going to talk about is the anti-inflammatory diet. Sorry, I'm having a few mic issues, but the anti-inflammatory diet, just a broad general overview of it is it's a diet that incorporates components of traditional Mediterranean and Asian dietary patterns that helped maximize the consumption of anti-inflammatory foods and reduce the intake of pro-inflammatory foods. And the goal of this is just overall keep your body in a state of low inflammation, which research has shown is the healthiest way to be and the healthiest way to eat. And it's challenging because we can all probably think of ways that we can eat healthier and be better with our diet. But even thinking about just one small change that you can make over a long period of time, that really can have a big impact. So I challenge you, when you hear these things, don't just think, oh, this is, so far away from where I am or where my family members are, or where my kids are. One small change really can make a big difference over a long period of time. And then several small changes over a long period of time can make an even bigger difference. So here is what the anti-inflammatory food pyramid looks like. So I'll just highlight a few things. Like at the bottom is what we should be eating the most of. This looks, somewhat of a similar shape to the food pyramid we all learned about in school and over the years. So focus on a higher consumption of vegetables and fruits, whole grains, and healthy fats. And you can see that, even proteins such as chicken and lean sources of protein are still up here at the top, where you shouldn't be eating as much of them. And then sweets and supplements are all the way up here. So I always think it's important when making recommendations or thinking about making changes is to talk about some evidence. And, if you're making these changes, is it really important? What does the science show about it? So there was a large study that was done with over 135,000 participants, ages 35 and up, and it looked at the association of how many fruits and vegetables and beans you ate in relationship to cardiovascular disease and death. And you can see from here that, eating more vegetables, fruits, and legumes really had an inverse relationship on all of these cardiac complications, which is great. And then they also found specifically in this study that eating raw vegetables was significantly increased with a lower risk of total mortality as compared to eating cooked vegetables. So that's an important thing to note too when you're thinking about making some diet changes. These next couple slides are just going to be some general tips of how you can kind of make some changes or incorporate eating an anti-inflammatory diet into your lifestyle or routine of yourself, your kids, family members. So one of the first things that they taught us was using the phrase vegetables and fruits instead of fruits and vegetables, just to put that emphasis on plants that have the lower glycemic load, meaning that they have lower amounts of sugar in them. And so even just saying vegetables and fruits instead of fruits and vegetables reminds you, oh, you should eat more vegetables than fruits. Eating a variety of vegetable and fruits, incorporating as many colors as you can. Cruciferous vegetables are known to be very healthy for us in reducing cholesterol and inflammation. Examples of these include cauliflower, cabbage, kale, bok choy, broccoli, and Brussels sprouts. And then also, vegetables that are rich in fiber are great and help our microbiome or the probiotics and bacteria in our gut. So then to go on to carbohydrates. For the anti-inflammatory diet, the goal of carbohydrate consumption is really to focus on whole grains. And what that means is not just looking at the packaging and see that it says whole grains, but you should actually be able to see the grain in the food. If you're shopping in the bread aisle, you can see that some breads, you can actually see the little seeds or oats or whatever grains in it. Whereas others might say whole grain or whole wheat, and you can look at it and not see any grain or any plant at all. It just looks like a brown white bread. Then other things to help with carbohydrates is thinking about swapping out spiralized zucchini or squash instead of pastas. Cooking your pasta al dente or not overcooking it or fully cooking it also helps to lower the glycemic load. And then just a quick cooking tip is cooking some whole grains in slow cookers overnight can help save some time. So putting oats in overnight or beans sometimes. So things like that. Then I will talk a little bit about some fats. So here, this has a lot of information, but one of the biggest things is extra virgin olive oil should be one of the main cooking oils that you use for the anti-inflammatory diet. And then another option would be an expelled pressed canola oil. I know fish oil supplements and omega-3 supplements are very popular. If you're looking for a fish oil supplement, you just want to make sure that you use a brand that uses molecular distillation, because you want to make sure that any potential contaminants are removed, especially mercury. We don't want to get too much mercury. You can okay. And then also some of these fatty acids, the EPA and DHA, can be found in cold water fish. So eating lots of salmon, sardines, and tuna are a great way to get some of those fatty acids without even taking a supplement. And then other omega-3 fatty acids can be found in some plant sources. So walnuts and soybeans and chia seeds are among some of those plant sources where you can get omega-3 fatty acids from. And then to think about the anti-inflammatory diet and proteins, as we think back to that pyramid, red meat was at the very, very top. So only eating that very occasionally, but replacing that with other protein sources can be beneficial. So swapping it out for salmon or fish or legumes or a vegetable heavy meal is a great way to do that. Adding additional healthy protein sources such as organic dairy and eggs is also an option. And then I thought it would be fun to talk a little bit about herbs and spices. I'm only going to highlight one today because there's so many. And this is something that if you're interested in incorporating in your diet, you really should have a conversation with one of your healthcare providers just to make sure there aren't any specific side effects or concerns for your own health that could put you at risk for complications. But overall, there's a lot of culinary herbs that can have antioxidant, antimicrobial, and antiviral effects, as well as just overall helping our health. One of the ones I was going to highlight today is kind of a fun one, which is turmeric. I feel like every time I go to a coffee shop, well, previously a couple months ago, people were drinking these bright yellow drinks, turmeric lattes. So turmeric has been in the spotlight, I feel like, on TV shows and in social media, but it is a potent anti-inflammatory agent. It's through the activity of the curcuminoids that are in it, and that's what leads to the bright yellow colors. And taking this can be very effective and is sometimes recommended by rheumatologists to help decrease inflammation. Again, there can be side effects from this, and it's not something that you want to take without discussing with your own healthcare provider. And then finally, I just wanted to talk a little bit about options for, an anti-inflammatory diet or a more whole food organic option for going through G-tubes. I am not an expert on G-tube feeds or formulas, but these are just a couple of things that I've seen at different vendor shows that I've been to or conferences, or that patients that I've taken care of have been happy with. So if you're looking for a different option to go through a G-tube or in something instead of formula, these are some options here. And of course, you could always consider doing a blenderized diet. But all of those things, you should work with a dietitian or a GI doctor before making any changes, because it can change how your gut functions, can lead to constipation and other things. So doing it under the supervision of a healthcare provider is important. And then I am going to move on to talk about mindfulness and meditation. So I'm just going to focus a little bit about pediatrics because that's my specialty. And here are some commonly used modalities in the pediatric population: biofeedback, hypnosis, music therapy, yoga, mindfulness or meditation, and then progressive muscle relaxation. I did see someone sent a question, but I think I'm going to answer all my questions at the end if that's okay. So mindfulness. So here is a quote. Mindfulness practice means that we commit fully in each moment to be present, inviting ourselves to interface with this moment in full awareness with the intention to embody as best as we can an orientation of calmness, mindfulness, equanimity right here and right now. I think this quote really encompasses what mindfulness is, just focusing on the present moment and orienting yourself to this moment in time right now and focusing on calm. So one of the things that I always like to do, I'm not sure who's listening in and how much experience you guys might have with meditation or mindfulness exercises. I know in a large group setting, if we were together, this is kind of where people might start to squirm because we are going to do a guided meditation exercise together. But you guys are all at home in your own living rooms, your own place where you need space. So I do encourage you to follow along. It's only going to be a couple minutes to just really take advantage of this moment to relax, engage, and experience what benefits you can get out of even just a minute of meditation and mindfulness. So just follow along with me. I'm going to read a treehouse relaxation guide for us. So get your body comfortable and gently close your eyes. Slowly take 3 deep breaths in through your nose and out through your mouth. Let's do this together now. Okay, well, that's probably not very relaxing that I got cut out. So spend a moment or two relaxing your feet and your legs, letting go of any tightness and letting them become heavy and relaxed. Imagine a wave of blue light traveling up from the earth into your feet and your legs, relaxing everything that it touches. Now relax your tummy and your chest and your shoulders, and imagine that this wave of blue light is sweeping through and relaxing this area for you. Pay attention to your arms and your fingers and allow the blue light to move through. Take a minute and feel how relaxed you are. Finally, bring the blue light to your head. Allow it to flow out of the top of your head and into the air around you. Beautifully done. Now imagine you are standing in front of a massive tree. This tree has deep, deep roots and branches that reach out in every direction. The tree is home to you, your very own treehouse. This is a treehouse of your own design. Now take a few minutes and picture how your treehouse would look. You can add swings. You can add windows, trapdoors. You could add plants, animals, your favorite things, your favorite colors. Just allow yourself to design the treehouse any way you would like. Can you see it? Good. Now allow yourself to travel inside the treehouse. Are you inside the treehouse? Good. Inside the treehouse, imagine anything that makes you feel good to think about. Place pillows, waterfalls, plants, trees, birds, pictures of mountains, anything that you would like that you feel good about when you think about. Go ahead and design the inside of your treehouse. Now that you know what the inside of your treehouse looks like, know that when you go inside, you feel really, really relaxed. This is a place to go to let go of all your thoughts and all your worries. Take a deep breath and allow yourself to feel very peaceful and relaxed inside your treehouse. This is a place you can go anytime you feel like you need more peaceful and more calm. Know that your treehouse is available to you anytime you would like. You can visit here whenever you would like. Now, take a deep breath and imagine yourself walking down out of your treehouse. Gently bring your attention back to the room, and now rub your hands together and make them warm. Gently place them over your eyes, and you can open your eyes whenever you are ready. So I hope you guys followed along with that. How do you feel? Take note of what benefits you felt doing just that short exercise together. So now that you had a few minutes of experience what mindfulness and meditation can do, I'm going to talk about some of the benefits of it. So that exercise was specifically for pediatrics, but I think it works great for adults too. But studies have shown that doing practices like that, meditation or mindfulness, guided imagery, can reduce anxiety, fear. It can help reduce the perception of pain, which can help decrease how much pain medication someone might need. It can help speed the healing of burns, cuts, and fractures, help with depression, decrease fatigue, increase self-esteem, and just increase overall sense of well-being. And just here is some studies. I'm not going to go into them all, but there's been quite a few studies that have focused on how mindfulness can help with various ailments or symptoms. So there's an overall review and then here, and if you're interested in getting access to any more of these studies, I'd be happy to share them. So now I'm going to talk about massage therapy and healing touch. So massage therapy and healing touch are somewhat different, but I'm going to talk about them all together because the benefits are the same and the differences are very nuanced. But the idea of them, it's a healing modality that utilizes the body's own process for repair, renewal, and well-being. And it is through manipulation of soft tissue. So here are some of the health benefits of massage or healing touch. It can help improve circulation, improve pain relief, decrease edema. There's been studies that show that it improves digestion and can help promote relaxation. Kind of to piggyback onto that mindfulness meditation exercise is sometimes, if you're, somebody who you have your thoughts racing or in your moment of more anxiety or difficulty calming your thoughts, adding just that physical touch. Sometimes adding that physical touch can just be helpful to aid into getting into a place of calmness or embracing the meditation or mindfulness. So having somebody give you a small massage or getting a massage done while you're listening to one of those guided meditation exercises can be a great way to fully engage and relax. And then for children who have some differences in their communication or additional needs, massage can provide some tactile stimulation. And sometimes it's very beneficial for kids who have tone differences. And it allows for enhanced body awareness. So massage, again, like I said earlier, it doesn't have to be done in isolation. It can be done, with music therapy. It can be done with a mindfulness or meditation practice. And really how it works is it's believed that it promotes healing and relaxation. If there are certain areas that you need to focus on, you can focus on specific areas or focus on the whole body. There's a lot of different types of massage, deep massage, Swedish massage, or just gentle touching, or more of a healing touch where it's just, providing a small amount of pressure. If you yourself as a parent or a loved one or are interested in learning some massage techniques, I highly recommend this book by Tina Allen. It's called A Modern Day Guide to Massage for Children. And in it, the first couple pages go through some different massage strokes and techniques. And then throughout the book, there's different like stories or prompts to do along with the massage. So on my boys, there's one where you're doing a nature walk and you're walking up a mountain, and then a thunderstorm comes, and then the sun comes out. And so that's a fun one to do. There's also one in there about making a pizza. So you spread the dough out on the back, then you add the toppings, and all those things are different, different strokes or different things that they feel. And you can ask, be like, they might like putting the cheese on, or they might like the peppers or the different touch and sensations. And then you can focus more on that to help them relax. And I also find too, that just performing a massage can be relaxing for you too. So if you have a child who has spasticity, they may get benefit from you massaging them, but you yourself as a caregiver might find relaxation in giving the massage as well. So I am going to talk now a little bit about aromatherapy and essential oils. And I'm so sad we can't be in person for this part, because normally I would be able to pass out samples, and we would be able to smell different things and share lotions. But you'll just have to maybe try these on their own if it's not something you are familiar with. So what is aromatherapy? It's the use of essential oils which come from plants, either flower, herbs, or trees, as a therapy to improve physical, emotional, and spiritual well-being. And clinical aromatherapy is the use of aromatherapy being by a controlled person who's trained in how these can help clinically. So what are essential oils? They're compounds, and they're contained in small glands or sacs of the different plant parts, and they are extracted to be that concentrated oil. They are very highly concentrated, potent, volatile, and flammable. And there's a couple ways that they can be extracted. So distillation is one way, which is through a steaming process. And then there's expression, which is through cold pressing. And this is typically how citrus oils are created. And there is a couple of applications or ways that essential oils can be used. The first is topical. And if you're using something topical, you always want to make sure it's diluted either in like a carrier oil, like olive oil, coconut oil, or there's a whole bunch of other ones, or a lotion. Sometimes you're able to add them too. Also, topically, some people like to add these to their baths. When I was at a talk just a few weeks ago, someone gave a great tip for how to add them safely into a bath, because if you just put like a drop or two in the top of your tub, it's just going to sit on top of the water, and then it'll touch your skin and not be diluted. She recommended using those little coffee creamers that you get at places, because there's like fat and oils in that, and just adding your drop of essential oil to that, shaking it up, and then when you add it to the bath water, it'll disperse evenly. So that's a nice tip that I had not learned before. One of the other ways that we can use essential oils is inhalation, and this can be with or without steam. You can see the pictures of these inhalers here. And then sometimes you can use a room diffuser, which diffuses the oil into the room. And then there's also personal aromatherapy jewelry. It's often, a metal piece of jewelry with a small piece of felt in it where you can put a drop or two. Ingestion is never, ever, ever recommended for these. That's just not. So at CHOP, we do use essential oils inpatient in some of the units, and they are using personal inhalers for them. They don't do diffusers, and we don't apply it on the skins with lotion or anything, and that's just what our teams are doing right now. But I think it's wonderful that that's an option for inpatients. On our neurology floor, they are able to use lavender and mandarin essential oils in a personal inhaler for patients. So how does things work? If you're inhaling something, how does it help? So the molecules are first detected by the nose, and then the trigeminal nerve receptors are activated. And then signals are received by the olfactory bulb and then travel further into the brain, the amygdala, hypothalamus, and other deeper parts of the brain. So here are some of the ways that essential oils can be used and what they can be used for. So inhalation of oils can be used to help with respiratory support, fatigue, headache, stress, anxiety, and then applying them topically can help with muscle strains, respiratory, depression, fatigue, headaches, anxiety, and then they can also be used for compresses for bruises, inflammation, or burns. So just to talk about some of the safety considerations for essential oils, making sure that you use a quality essential oil, making sure that it's pure and not tainted, making sure you're aware of the chemical composition of the oil, being mindful of the method of application, as well as the dilution. So some oils are safe to be applied to the skin at a specific ratio. So making sure you're aware of those and that you can, add the right drop of the essential oil to the right amount of lotion or carrier oil is important. Also, you want to make sure that the integrity of the skin, or that there's no openings in the skin that could be a complication for adding an oil there. Just to talk a little bit more about the quality and the composition of the oil, I know there's so many places that you can get essential oils, and some are better than others. I would just recommend a company that's willing to disclose their testing data and be able to give you and show you, look, our oil was tested and it's shown to be 90% this oil, which is what you want. And if a company's not willing to give you that information, I would avoid purchasing oils from them. And then some of the other things that you just want to be cautious of is, people can have allergies, just like you can have allergies to plants. You can have an allergy to essential oils. Some of the oils may exacerbate somebody's asthma. There are oils that are contraindicated if you have heart problems or in pregnancy, or if you have seizures. And then really making sure that the age of your child is greater than 3. Children under that age metabolize essential oils differently, so it's not something we want to recommend using for small babies and toddlers. Just some other considerations too is, even though we know that lavender is great, and I'll talk about that later, for relaxation and anxiety, someone just may not like lavender, and so it may not be helpful for them. Some people associate oils with an unpleasant experience, and so then even that the oil may be beneficial, it's not going to work well for them. And then we already talked about the quality, purity of the essential oils. And then in terms of the quality, you just want to make sure that you are wary of products that are labeled fragrance oils. Those probably aren't the best and don't have the purity that we would recommend for using aromatherapy. So there are 2 places that I would recommend looking if people are interested at CHOP. They use hospital grade approved essential oils, and they order them from a company called bestaromatherapyproducts.com. That website, they have, you can get oils themselves, you can get pre-made inhalers, and you can also get pre-made lotions and stuff, which is nice. And then there's another company called Herbararia. I think if you look up Herbararia soap, they have essential oils, and they've been, that's not where we get things at CHOP, but I've used them, and I have friends that have used them, and they will send the purity ratings for their oils. And then, so I'll talk a little bit about peppermint. So this was first introduced in England by the Romans, but then it came to New York in the 1800s. And now most of the peppermint essential oils that in Washington and Oregon. And this is one of the most common essential oils used. This is one that you should not use on your skin, and you should avoid if you have any heart issues. But some common uses of this include anti-nausea, pain, and an antispasmodic. And then lavender, this is always a favorite. This is most common. This is very helpful for all types of skin problems. It can help with calming, headaches. Again, it's an antispasmodic, so it can help with coughing and some respiratory concerns. And then it also helps to alter the perception of pain. Then mandarin, see a little history of it here, but this is one of the gentlest and safest essential oils. So this is one that, you know, if you have someone and you're not sure how they may react, or they, you know, just tend to be more sensitive to things, this is a great one to consider using. It's safe in the children and elderly. This can help with insomnia, nervous tension, restlessness. It's also great for indigestion, and then it's a nice skin moisturizer as well. And that is it. So I think I will look through this feed and look at the questions and answer them. If you have any more questions, type them in. Okay. Great. So here's a question from Christy DeMarco. She loves the focus on improving diet. Has there been any evidence that this diet improves symptoms in leukodystrophies? So I haven't seen any research specifically focusing on patients in leukodystrophies, and I haven't seen much evidence on this studies done specifically in the pediatric population. I think that's an area definitely to be studied. So maybe in the future somebody will do that. But I know anecdotally, I do hear from a lot of families that changing diet can improve different symptoms. Just a simple little case study that I heard from somebody else was in terms of GI. There was a patient who had really bad constipation. And in some patients with leukodystrophies, you know that their constipation and GI upset can lead to increased tone or discomfort that makes their dystonia worse. And they did go to an integrative practitioner who recommended some diet changes. He had been getting, I think it was Pediasure Peppermint formula through his G-tube, and they did some lab work and they thought about changing it. And their first step, although the family's ultimate goal was to switch to a blenderized diet, the integrative GI doctor who saw him suggested switching to one of those blends that I showed. I can't remember which one they picked. And within a couple weeks of being on that, his constipation improved. So even though it was something little, it was a fairly easy switch for the family. Those many of those are approved by insurance companies now, which is great. Yeah, so it improved his constipation, which then improved his quality of life and his tone because he was much more comfortable. So it would be great if somebody could do a study and compile all those little case studies and put it together. Oh, great. And then I have another comment from Christy about massage being so awesome from pain relief, and she wishes it was covered by insurance. And yes, I agree too. I wish insurance companies would cover some of these more alternative medicine practices. At CHOP, we do have massage that is available. And I'm not sure what they do about insurance, if they get insurance coverage or if it's just part of some of the clinics or part of some of the inpatient treatment plans. And then Christine DeMarco as well said, do you have a sense of the smell to benefit from aromatherapy? Sense of smell to benefit. I don't quite understand that, Christy. So if you want to resend it or reword it, I'll try to answer that. And then Lou Ann said, she asked, what is the difference between integrative medicine and functional medicine? How do we find such a practitioner to help our team of doctors? Yes. So I think integrative medicine, I think a functional medicine doctor is going to have an integrative medicine mindset, if that makes sense. Whereas, and functional medicine tends to be separate from your like primary care team. So integrative medicine would be really having somebody help you with essential oils or massage or yoga and talking about that with your primary care team. So to find a practitioner to join your team of doctors, I think I had thought about how I would answer this question before I did the presentation, and I just think it's really hard to find. I know in the pediatric world, many of the big children's hospitals are now launching integrative medicine programs. So I would suggest looking there and see what they have. I know here at CHOP, I was aware that we had a program, but it wasn't until I got engaged and involved in the fellowship program that I even realized half of what they were offering here at my own institution. So I think you might have to do some researching, and I think maybe word of mouth, if you can ask other families or friends that are nearby what they have or what resources they know of in your area. Do you have here is the question again. Do you have a sense of smell to okay, so if people can't smell, will aromatherapy still work? That is a good question. I am not sure. I can find out and get back to you. Does anyone have any other questions? Okay, yep. Someone's asking about deep muscle relaxation. Was that back in the mindfulness and meditation? I just want to make sure I'm talking about the right. So I'm going to assume that this is progressive muscle relaxation. This is the idea where you think, where there's often a guided resource to it where you relax your muscles, then maybe you tighten them up for a couple seconds, and they guide you through tightening and relaxing your muscles through your whole body to get a sense of deeper muscle relaxation. Great. Thank you, everybody, for your time and your great questions. If you have any other questions, or if you live in a specific area and you want to know what resources may be there, I'm happy to reach out to my colleagues and find out and help you find integrative health services near you. Thank you again for your time.